All right, welcome everyone to the Thrive series. My name is Elsie and I'm the events coordinator at the Masonic Cancer Center at the University of Minnesota. On behalf of the Thrive planning team, I'm happy to welcome you to the fall 2023 series. If you have attended a Thrive program before, welcome back. And if you're new to the series, we're so happy to have you here. The Thrive program is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. We're proud to offer 6 sessions this fall. Today is the last session of the season, but you can rewatch the previous sessions on our website, z.umn.edu/Thrive series. Tonight, we will hear from Allison Breininger and Pamela Mason. Allison is a caregiver and creator of The Negative Space, an organization that aims to shine a light on the realities of caregiving and provide services and education to help equip caregivers with tools and strategies. Pamela Mason wears many hats, including as the Associate Director of Cancer Center Partnerships at the American Cancer Society, and is the Commission on Cancer Network co-chair for the Minnesota Cancer Alliance. Pamela has been a dedicated advocate for caregivers in her roles. Before we get started, take a moment to locate the chat box. During tonight's presentation, please use the chat box to submit your comments and questions, and at the end, the speakers will be available to answer these questions. At that time, you may also unmute yourself to ask your questions. If you are a University of Minnesota employee or spouse participating in the university's employee well-being program, we will put a link in the chat shortly to complete the survey to mark your attendance today and earn your well-being points. All right, now I'll let Pam take it away.
Okay. Well, thank you very much. It is just an honor for Allison and I to be here tonight and talk about caregivers. And we hope that you find this information to be very helpful. I'm going to start off with some research, if you will, and then I'm going to turn it over to Allison because she's really the face behind what I'm going to be talking about today. Next slide, please. Okay. So I wanted to start our evening with this quote because November is a busy time in the cancer space when we think about it being National Prostate Cancer Awareness Month, National Lung Cancer Awareness Month. Well, it's also National Family Caregivers Month. So I wanted to start off with this quote from Rosalind Carter. There are only 4 kinds of people in the world: those who've been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. Just think about that. You know, caregiving touches us all everywhere around the world. It is a 24/7 job, okay? And it's very hard. Next slide, please. I thought I would start off the talk by sharing this picture with you. You know, as a caregiver to my son, it represents to me a real caregiver perspective. So when I see that road, for example, sometimes you may think there's no end in sight. You look at that road and you see it's twisting and it's turning, and oftentimes on a caregiving journey with our loved ones, we are experiencing those twists and turns, right? I look at that water and it's really smooth, and some days do go smoothly and some days don't. It's really rocky. It can be really rough. I look at this picture and on the one hand, it's beautiful, but yet it feels isolating. And sometimes we as caregivers feel like we're isolated and maybe have no one to talk to. And then I look at this picture and sometimes I feel like, it's like a sense of relief because you can breathe sometimes, right? And then there's some days that are bright and some days that are overcast. And so I just wanted that to sit with you as I continue the talk today. Next slide, please. Okay. So according to the 2023 Cancer Facts and Figures, ACS estimated that 1.9 million people would be diagnosed with cancer this year, and about 17 million of them would be cancer survivors. So prior to the pandemic, it was estimated that there were about 53 million caregivers, and of those, about 2.8 million of them were caring for someone with cancer. So imagine what that looks like today, post-pandemic. So what are just some of the things that caregivers do? So we think about things we all do on a day-to-day basis. Caregivers do that plus more. So on the left-hand side there, appointment coordination, transportation, home and lawn maintenance, grocery shopping, meal prep, etc. Activities of daily living, bathing, grooming, instrumental activities of daily living, managing the checkbook, managing medications, providing emotional, informational, and spiritual support. We're doing that with our loved ones, but oftentimes we feel like we may not be getting that. And that's something that we need. And then as caregivers, in addition to being a part of and hoping to be a part of the healthcare team, hard conversations take place. Hard decisions have to be thought through and made. And when you look over on the right-hand side, the thing is nowadays about 72% of cancer caregivers are doing things that only at one time were skilled medical professionals doing. They're oftentimes doing it unpaid to do it, and they're untrained. They're doing things like managing symptoms, managing medications, breathing treatments, wound care, G tube feedings, catheterizations, and more. So why does this matter? Next slide, please. Okay. It matters because as we continue to advance in the cancer space, we are also seeing trends that are going to continue to impact caregivers. So for example, we're seeing people live longer with advanced cancer. So that means that caregiver journey is going to be longer as well. We're not seeing people with just cancer, but we're also seeing people with cancer that also have other chronic diseases, whether it's like dementia or heart failure, increased costs of medical care, increased complexity around home medical management. People these days seem to be in and out of the hospital, and that's so complicated, as we all know, when you are trying to coordinate care between primary and other specialty providers. And then we may think of ourselves when we think about our upbringing and maybe the people we know and just having access to resources. Maybe it's like a good insurance plan through our employer. But caregivers in that population are really diverse too. There are people who are caregiving in the United States that English isn't their first language. They may not have access to these resources. They may not have access to insurance. So when we think about social determinants of health, we also need to be thinking about addressing those needs when it comes to caregivers. Then we're also seeing increased remote and distance caregiving from afar. Next slide, please. And so this matters because we are seeing caregiver burden. And the research shows that at some point in time, caregivers are going to experience this burden or this burnout. And that matters because research suggests that the quality of life of a caregiver often corresponds to the quality of life of the loved one that they're taking care of. So if you have a distressed and unhealthy caregiver, chances are the patient's going to be experiencing some of those similar things too. So there are different components of caregiver burden, and I've just put a few here, but there's a psychological component. We know that caregivers are being diagnosed with higher rates of anxiety and depression. And post-pandemic, we are also seeing caregivers being diagnosed with PTSD. From a physical standpoint, we are seeing caregivers with cardiovascular disease or poor immune functioning, the inability to sleep, or just being extremely tired. You know, we oftentimes think about maybe caregivers as just naturally being healthy. Well, that's not necessarily the case. And then oftentimes we're seeing that the roles are being reversed. They have been used to maybe somebody taking care of them, and now they're having to do it. We're also seeing that caregivers are not eating right, not exercising, and even foregoing their cancer screening. And we all know how important it is to early detection so that we can catch cancer earlier when we know it's easier to treat. And then there's financial toxicity. Everything costs so much, and there's time and logistical toxicity when you think about staying on the phone with an insurance provider to handle a claim, or just traveling back and forth to your treatment appointments. Okay. Next slide, please. Okay. So before I turn it over to Allison, I just wanted to share this image with you. I'm borrowing it from Dr. Allison Applebaum, who is the director of the Caregivers Clinic at Memorial Sloan Kettering, and she also is a psychologist. And in her research, she's basically showing this cancer continuum. And what this arrow shows, in essence, is if we aren't able to support the needs of the caregiver early on in the process, it's just going to get worse along the cancer continuum. So naturally, at the beginning, when your loved one's first been diagnosed with cancer, it's overwhelming, it's scary. Every emotion that you can think of, you and your loved one feel that. And throughout treatment too, recurrence, disease progression, and into hospice and bereavement. But I want to come back to survivorship, because during survivorship, you and your loved one may feel a sense of relief, right? You can maybe breathe a little bit, right? You can maybe try to establish a sense of normalcy. But what Allison's research has shown is that actually caregivers and their rate of distress is oftentimes higher during survivorship. And that's because in the beginning, you're in this fight or flight mode. You're doing everything you can to support your loved one and to help meet their needs and to get questions answered. And you're just on autopilot. And then in survivorship, you may kind of start to settle down. And when you do, some of these feelings that you couldn't express because you didn't want to further stress your loved one or make your loved one feel bad, some of these emotions start to rise and start to come out. The other thing with survivorship is it can be short and it can go on for years. And so all along, there are these what ifs that pop up in your mind, right? What if my loved one gets sick again? So that uncertainty and that fear, that never really goes away. And so I just wanted to set the stage for you today with some of the research, some of the things that we are learning, and just stress the importance of caregivers and patients, and acknowledging and seeing them both, and making sure that we are also supporting the caregiver too. And now I'm going to turn it over to Allison, because like I said earlier, Allison is a living story behind everything I just talked about tonight. So thank you.
Thank you. All those statistics and almost everyone that you said, I was nodding along because those things have happened to me. I have experienced them firsthand and I continue to experience them. So grateful to be here. I'm Allison Breininger. I'm a caregiver for my husband, and I'm also the founder of a nonprofit called The Negative Space. Our mission is to change the way caregivers are seen and supported. And the title of the name Negative Space actually comes from the artistic concept, which is that in a piece of art, the negative space is everything in the background. It's the pieces that we don't really pay attention to, that we don't notice, that we don't appreciate, but yet that make up the picture. And that if they were gone, the whole picture would change. And from my firsthand experience, I have seen that that's true about caregivers, right? We're a huge part of the picture. We make up what that picture looks like, and yet we're very often unseen and unsupported. And so I'm so grateful that that we get to be here tonight to talk about this. Next slide, please. So in 2011, my husband had a bone marrow transplant. And that was one of the first things. He got a diagnosis and then went right to transplant. And so I didn't have this moment of, am I a caregiver? Am I not? Because I was given a contract to sign, and all of his treatments has been at the University of Minnesota. And so I actually signed a contract. And this is an excerpt from the actual thing that I signed. It said, these tasks include, that I agreed to, helping with transportation to and from clinic appointments, assisting with daily activities, food, laundry, housekeeping, helping the patient to communicate with the medical team, monitoring and assessing symptoms, central line care, assisting with medications, and providing emotional support. So I had to sign something because you can't have a bone marrow transplant unless someone agrees to sign this contract and to be with you 24/7 for 100 days. So I think in that moment, I must not have been paying attention to the details. I think I just, of course, this is what I'll do. I signed it. And then once I got into it, I thought, oh my goodness, this is a more than full-time job. And like Pam said, one that for which I was not trained and for which I am not paid. And I counted up the other day, and I think I'm on around day like 4,380. So I'm far past my 100-day piece that I signed up in this contract. Next slide, please. So just a little bit about our story. This is my husband, Sean. We were high school sweethearts, married in 2002. We adopted our daughter from Haiti in 2009. And then we had about 1 year with her until he started having some symptoms. It took us about a year to get a diagnosis. His diagnosis is called Fanconi anemia, which is a rare genetic disease that causes bone marrow failure and then cancer at a rate of around 700 times that of the rest of us. So since that, first thing he had was that bone marrow transplant at the U of M. Since then, you can see that list of cancers there. He has had gum cancer, cheek cancer, about 150 skin cancers. He had tongue cancer and had half of his tongue removed. Bladder cancer, had his bladder removed. Throat cancer twice. And then just a week ago, had surgery for esophageal cancer. And so this is the way this disease works, is that the cancers will just continue happening. And so I was thrust in my 30s into this role of being his caregiver without any medical background while parenting, and really haven't stopped since, because it's just been diagnosis after diagnosis since 2011. Next slide. So when you hear all of that, what you likely picture, especially if some of you here tonight are caregivers or if you're from the medical profession, you might picture things like this. But what you might not picture is this. So I have been there with him by his side for, I would say, 96% of his procedures and his hospitalizations and his appointments, and all of them have had an impact on me. And yet very rarely is that acknowledged, the impact that it's had on me in my life. And so I looked at his chart one day and I said family updated, wife is bedside. So I was like, that's the only mention that I got in the chart. And I realized that even his disposition and his like musculoskeletal system got more words in the chart than I did. And so as Pam said, there's so many statistics and she covered those beautifully, but a couple that I just want to highlight. I saw when I was looking at this, it stuck out to me that 61% is on here twice. 61% of us are women, 61% of us work outside the home. But the 61% number that is not on this chart, but that's been sort of haunting me lately, is the number that we have a 61% higher mortality rate as caregivers than our peers. That is sobering, to say the least. And a friend of mine who's been a caregiver for her husband for decades, just this last week had a heart attack and is, doing as okay as she can. But her doctor said, really, it's because you're a caregiver. It's because of the stress in your life. And that's terrifying to me and to my peers, knowing that we're doing this really hard thing. It's hard now. And in addition, our bodies are taking the toll of that. Next slide, please. So that just makes me so glad that we're here tonight. And that we get this whole hour dedicated to us caregivers. And so I love this quote: a prerequisite to empathy is simply paying attention to the person in pain. And very often when people would think that, they would think about my husband. But tonight we get to think about me and all of my peers and all of us who are also in pain, but who often don't get the attention that we need and deserve. So this picture here, and you'll see, like I said, all of our care has been at the University of Minnesota. And so all the pictures are from the U. And I could do a 3-day workshop on what it's like to be the caregiver in the clinic at the hospital, in the waiting room. But those are things that people see. There's much that they can learn, but those are the things tonight I want to talk about the things that are more invisible, the things that make caregiving challenging that people often don't see. And so next slide, we'll get into that. So caregiving has changed our house. So for a while, off and on over the years, my husband has had a PICC line. That means that a nurse comes into our home once a week, at least. So it means nursing people coming in and out. It means deliveries of medical supplies. You can see that one here on the right, I tried to like make it look a little festive at least. I was like, if I'm going to have this sitting on my dresser in my bedroom, at least I'll make it look festive, right? And so it has changed the way that our house is, our house feels. And even when we bought our most recent house, we thought about things like accessibility. Like, he can do stairs right now. Is that always going to be the case? Let's get a bedroom on the first floor, things like that. And so even our home, which is kind of supposed to be the safe space, feels like the medical thing is pervasive and has come into our space and has changed the way it feels. Parenting. So I mentioned our daughter was around 4 when he was diagnosed. And so this was her, she was in kindergarten. This was her when he had his bone marrow transplant. In the first few days of that, when he was still feeling okay, and we were trying to figure out how do we include her and involve her in a way that she feels like she's part of the story, but not so much that she feels like she is a caregiver. We've been trying to be really careful about that over the years. So her 4-year-old version, she helped him put on his hospital socks. But you can picture me spending 38 days in the hospital with him as he went through this awful, awful thing, and then coming home each night to a 4-year-old, and then parenting a 4-year-old as I balanced what was happening during the day and to her dad, right? Next slide, please. So as she has grown up, we've given her options. Like, she thought this was kind of cool. He got a feeding tube, and she thought it was kind of cool to be able to hook him up. So again, we sort of give her options as, you know, when she wants them, but have been really careful to let her be the daughter and not the caregiver. This is, I think, one of the hardest things for me about being caregiver is the feeling pulled. And so if I'm at the hospital with him, I feel like I should be home with her. If I'm at home with her, I feel like I should be at the hospital with him. So these are a couple snapshots of that. The one on the left, he and I are in the hospital and we're FaceTiming her at home. On the right, I'm at home with her and we're FaceTiming him in the hospital. And these are at different ages, you can tell. And so it's that constant pull of, I'm not in the right spot. I should be somewhere else. Someone else needs me. Where else should I be? Especially between your child and your loved one. She is now at the age where she's looking at college. And she took a tour with her classmates to the University of Minnesota in Duluth. And her comments when she came home is that all of the logos and the colors of it being a U of M school reminded her of the hospital. And so you think about how much that has like permeated her being of all those times over the years visiting him in the hospital, and how that has impacted her life, and then how it has impacted me, you know, parenting her through this experience as I'm going through it as well. Working. So as you saw, 61% of us are working, and we often have to because our person is likely not able to work, or we need to keep up the insurance or things like that. And so sometimes we have to work even more when we are caregivers, even though the average caregiver works or spends around 25 hours a week caregiving, which is more than a part-time job. So I have tried to balance over the years. How do I work while I'm doing this really big caregiving job? Next slide. So I have done things like interviewed candidates walking between the clinic and the hospital. I have done lots of work bedside at the hospital. I have gone and trained groups of people after sleeping in the hospital overnight. This was a picture of me like all dressed up in the blazer, ready to go because I had a big presentation, but he had an infusion. And I wanted to be calm, and I wanted to be just like, of course, I want you to do your very best for him, and let's take our time. And at the same time, I was sweating under that blazer because I knew we had to get out of there so I could go home and get there. And so often, if you see a caregiver somewhere, they are not just doing the really hard thing you're seeing in the moment, but they're being pulled in all these other directions. Next slide, please. This was a picture my husband took of me. I'll share with you a Medicare nightmare story that we went through. And I spent a lot of time as a caregiver on the phone, right? On the phone with all of these systems, many of which are broken, and that we have to sort of fight with. And so when often people think about the medical part of caregiving, but this is a huge part of it as well, the finance and the legal part, and just the fighting with systems and being on the phone. Next slide. So this, I know this looks like it's sort of like clip art, but this is actual photo of bills. As caregivers and as patients, you know, every single day, medical documents come in the door from the insurance or from bills or appointment reminders. And at one point in my husband's medical journey, it was impacting his mental health so much that I had to say, like, you don't get to look at the mail anymore. I will get the mail from the mailbox. I will sort through it, and I will give you like the lovely cards that come from other people, but you don't get to open anything. But then, of course, that put all of that on me, right? And so just the dealing with the paperwork and the business aspect of caregiving is a huge, huge part. So I mentioned a Medicare nightmare. At one point there, we changed insurance, and suddenly we found out that a lot of the supplies he was getting were no longer going to be covered. And so we had a moment where the supplies arrived at the doorstep, and we were told that if we brought them in the house, we would have to pay for them. And so I literally had to sit on the front steps deciding, do I bring these into the house when we're going to have to pay out of pocket for everything in there? Do I leave this something that he needs on the front steps and have them come pick it up? I mean, these are the sorts of things and decisions that caregivers have to make, in addition to all the medical stuff. And so just know that it's so much beyond the medical duties that we have to perform. Our physical health. So Pam talked a lot about what that looks like, and you can see I have a lot of pictures or a lot of moments that I have slept in chairs in various spaces. And, you know, we all know that nobody sleeps well in the hospital. And so it has absolutely taken a toll on my physical health. Things like eating in the cafeteria, not sleeping well, not getting the exercise, not getting the screening. Like I said, he just recently had a esophageal cancer diagnosis. And so I kept getting the reminders that it was time for me to go get my mammogram screening. And I thought, I can't deal with two cancers at once. So now that last night, we just got a good pathology result, which is fantastic. And so I was just thinking today, okay, now I can take on this other thing. But last week I just couldn't. And so then that can impact my physical health as well. Mental health. I mean, again, we could spend a week talking about this, but if I think about the actual trauma that I have been through, being in these spaces and watching all of these things happen to my husband, it's pretty incredible. And then the piece about the fact that as caregivers and patients, we have to keep going back to, I almost want to say like the scene of the crime, right? How many times do we have to go back to that same procedure room and watch this terrible thing that we're paying them to do, that we're asking them to do, happen to my husband? And so like typically if something traumatic happens to a person, they can avoid that place. But for us, it's a place that we continue going to, and we go to with a smile, and we go to regularly, and we pay to go there. And so the toll on a caregiver's mental health is huge. And I think it's true when Pam talked about anxiety and depression and PTSD, and the rates that are that in caregivers is so much higher than in our peers. This was something that a friend of mine drew after hearing this story that happened to me. This was like March 23rd, 2020. COVID was brand new and he needed to go to the ER. And I remember driving there and saying, what if they don't let me in? And he said, we have to prepare ourselves for that, because this was brand new. We didn't quite know the rules yet. So when we pulled up, everybody came out in their hazmat suits and said, no visitors are allowed. And I said, I'm not a visitor, I'm his wife. And they said, no, you're a visitor. And so then they had to take him away, and I just had to go home. And so my friend, who so beautifully depicted this, put on the bag that I have on my shoulder there. So then I took with me like his medical history, my personal knowledge of him, the advocacy, the connection, the comfort, all of those things that I typically would have provided, went home with me while he was taken away. And I understand for safety's sake, and also having to drop your loved one off at the ER and drive away was really awful, really awful. And I know that many of us had to do that during that time. And then this piece, I love this shirt that someone got for him. He turned 45 this week, which is beautiful. And he is long past the median age of death for his disease. And so even things like his birthday are sort of a mixed bag for us, because we're so grateful and we're so excited that he has made it to this. And also it's weird to be so excited about someone turning 45 and that they have gotten to that age. So the constant sort of that message in the back of our heads, it's there. And that absolutely has an impact on my mental health as well as his. So you might hear all of that and think, oh, well, first I want to say this. Imagine all of that I go through and that most of the world doesn't see it, doesn't acknowledge it, doesn't recognize it, doesn't support it. And that I am one of 53 million people who are going through this really hard thing that people don't see and acknowledge. And so when you hear that, you might think like, how are you even upright and talking, right? And you might be tempted to say a very well-meaning, like, are you taking care of yourself? Make sure you're taking care of yourself, Allison, right? This sort of hashtag self-care thing that is so important. But I want to say that instead, I want us to think about this quote on the next slide, please. I love this quote. Shouting self-care at people who actually need community care is how we fail people. So imagine all the things I just told you that I do in a day and how tired I am and all of those pieces. And then if you say, I'm really worried about you, you should make sure you're taking care of yourself. You have just added something else to my list, right? I wish that I could see your faces because I'm imagining if there are caregivers here that you are nodding along with me, right? And so it feels well-meaning, and yet the fact that you're recognizing that we might need help, but instead of helping us, you're telling us to do it, feels really hard. And so that's why I'm so glad that we're here tonight and that caregivers are starting to get more recognition, because it's the community care that we need to build up instead of just saying self-care. So let's get into a little bit of a couple of ideas about what that could look like. So if you're not a caregiver and you're here tonight, whether that means you're a medical professional or just a person who wants to learn more, or you're a patient, I want you to start seeing caregivers. We are everywhere. Sometimes people say to me, I sell these caregiver gift boxes, and they say, well, I would buy one, but I don't know any caregivers. And I always say, like, baloney. Like, you have seen so many caregivers today. So many of us are doing this role. So start seeing them, look for them. Think of all the people in your life who have these really hard diagnoses and realize that hopefully almost all of them have a caregiver behind the scenes that is going through these hard things. Look for them. When you see them, acknowledge them in this hard thing that they're doing. Thank them, right? Just a little thank you goes a long way. Check in on them. See how they're doing. See how they're feeling, how it's going for them. Offer some support. And we'll talk about how to do that in a specific way, not just a let me know how I can help, right? Offer a specific support. Look for some practical ways to make their days easier and to provide support. So, like I said, we had the surgery last week. A friend of mine just said, I can do yard work or a house cleaning. Which of those would be helpful? We have a giant tree outside. I said, I would love some raking. She said, great, I'll be there on Thursday. Perfect. If she had just said, let me know if there's anything I can do, I would have never reached out. But she made it very specific, and it was like a gift to me that she took care of those leaves and I didn't have to. If you're a medical professional and you're here tonight, I want you to consider, I know that Epic and a lot of those places don't always have a good spot for this. And so think about how you can make a chart about the caregiver. How can you make some notes in the background about who it is that's showing up at all these appointments and what they might need and what their role is as well. So what can that look like? So here's one that maybe to think about if you're a medical professional, or let's say it's somebody, you go to a place of worship and you see a caregiver and their spouse or their person show up at church, something like that. You could say something like, I imagine it took a lot to get here today, and that you may have had to rearrange your schedule to do so. Thank you. If someone at a medical appointment said that to me, I think I would turn into a puddle, and because I would be so grateful that someone recognized that. I know that caring for a loved one can be a lot, and that your person's illness must have an impact on you as well. Can our team connect you with resources for wellness visits, mental health support, or anything else? So again, that could be from a medical professional, or perhaps it's from a community group, or maybe it's just you as a friend. Here's one if you're thinking about just a neighbor or a friend helping. I'd love to bring your family dinner some night this week. Does Tuesday or Thursday work better? Again, the specificity of that tells me, yes, you're in. You really want to do this, and helps me to get over the guilt of asking for help. So I can say Thursday, Yes, thank you. And then caregiving is hard. Don't forget to take care of yourself, right? But Alyssa, click the button because we're going to not say that last part, right? So we're going to say caregiving is hard, period. That's it. End of sentence. We don't need to say the next part. Sometimes we just need someone to acknowledge us and be with us in it. So if you're not a caregiver and you're here tonight, I hope that you are picking up just some tiny, we could be here all night and I've got so many ideas, but some tiny ways to start to provide community care to folks. I'm wondering if it's okay, I would love to, if there's anybody here who is interested in putting in the chat, if you're a caregiver, is there anything else? Is there a phrase or some other way that someone could be helpful to you as a caregiver? In addition to some of the things that I have said tonight, what are some phrases or ways that you wish either the people in your community, your informal community, or your medical professionals might be helpful? So you can put that in the chat if you'd like. You might just be there listening tonight, and that's okay too. And if you want to just share with us as the presenters, you can choose that. Give you just a minute to think. All right. So for non-caregivers here, think about just one little thing that you can do to start seeing and acknowledging and thanking and supporting the caregivers in your life. And then for the caregivers who are here, I want you to know that I see you and I acknowledge you and I have resources for you. So if you could go to the next slide, please. At the Negative Space, a couple of things. We have a podcast that's me and another spousal caregiver who is a man caring for his wife called In Sickness. And you can just find that anywhere you get your podcast, and we cover all kinds of topics. We have virtual support groups that are based on the podcast topic. And it's for any type, cancer, any type of caregiver, people caring for parents, caring for kids, caring for spouses of any age, any disease. I also provide one-on-one coaching support because sometimes caregivers just need someone who gets it. I know I hear from people a lot that they had a therapist or they have a therapist, but that person doesn't get it because they haven't been a caregiver. So if a one-on-one session would feel helpful, let me know. You can follow me on social media where I sort of give tips and tricks, but also you can follow along with my story. And sort of sometimes it's helpful to see someone else kind of playing that out. Like I said, I have caregiver gifts, and then I'm also, in addition to trying to really provide direct support to caregivers, I'm trying to change the conversation. Actually, I'm trying to start the conversation around caregivers. So doing speaking engagements like this or consultation with groups to really help seeing that we're there, we're everywhere, and we need that support. So my contact information is there at the bottom. So thank you for that time. Pam's going to talk a bit more, and then we'll have time for some questions.
Thank you, Allison. You know, for those of you who are on the call, I've heard Allison speak before, and she just moves me in every way. Thank you for sharing that story, and just thank you for all you do, Allison, for caregivers everywhere. Just am really grateful for that. Okay, so I'm just going to touch on a few resources that we have at the American Cancer Society. If you could go to the next slide, please. Okay. One thing I wanted to share with you is relatively new, and it's called ACS Cares. And CARES stands for Community Access to Resources, Education, and Support. And if you look at those three pictures there, we really have like a three-pronged approach to how we do this. So we have an app that I will tell you about in just a second, but through this app, you have the ability, based on how you answer a series of questions, to get information right at your fingertips, whether you are, sitting in that waiting lobby, or if you are sitting in your bed at night. It's our way of trying to help meet caregivers and patients where they are. In the middle there, access to information. We have our 1-800 number, 1-800-227-2345. We have live chat on cancer.org. And both of these functions, or the 1-800 number, is available 24/7, 365 days a year. where caregivers and patients can call and ask whatever question they may have on their mind. That service is available, and it's backed by oncology nurses for some more complicated questions. And then that third bucket there is a support system where through the app, or if you go onto cancer.org, you have the opportunity to connect with community volunteers, as well as one day we're working towards this in-person in-person volunteers that work at the hospital systems. Next slide, please. So this app is available on online at Google Play and the Apple Store. Next slide, please. Okay. And what I was going to do tonight is show you or have you listen to a demo that is from a caregiver perspective, but in the interest of time, this presentation and the recording is going to be available afterwards. And so I encourage you to go online when your schedule allows and listen to that demo, because it basically walks you through, as I said, a series of questions. And in this particular demo, it talks about this woman is checking the fact that she's caring for a loved one with cancer. She's interested in clinical trials, and then she's interested in transportation options for her loved one. Okay, next slide, please. Okay, and I wanted to share that with you because not only do we have resources specific to caregivers, but in essence, everything that we have available for patients is for caregivers too. Because Allison kind of, alluded to this when she talked, but, it's the caregivers who are making those appointments and reaching out to better understand, where can I get transportation support, or maybe where can I get lodging support, et cetera. So on the left here, you see our caregiver resource guide. This is available online. It can be downloaded. We also have some hard copy versions here, but it covers a variety of topics such as like cancer caregiving, like what is a cancer caregiver? What should I be doing? I'm not really sure how to, talk to my loved ones sometimes. How can I cope with some of these things that I'm going through, and how can I help my loved one cope with things as well? So we have that, for example. And then on the right-hand side, we have caregiver support videos. Now, I know there's nothing like hands-on training, right? And I think that is what can be so overwhelming when we think about, cancer care and how some of that's done in our homes, right? Allison showed us pictures. She talked about it. There's nothing better than having that hands-on training, but sometimes that may not be available. So if you go online at cancer.org, we do have videos that speak to like physical care stuff, like how can, you help with the drain care and lifting your loved one, medication management, etc. And there in the middle, there are some videos on caregiver self-care, just about, eating and exercising correctly. And then advocacy, how we can, again, be a part of that healthcare team, speak up, because your loved one better than anyone else, right? So we think about that picture that Allison had just shown with everything written on her bag, right? So it's caregivers being that advocate and speaking up when it comes to working with their healthcare team, even working with insurance, for example. So there is a hyperlink there at the bottom that basically says Cancer Caregiver Support, American Cancer Society. That will take you right to those resources. Okay, next slide, please. Okay. So that's all I have at this point. We are going to, open the floor. We are more than happy to take any questions that you have for Allison and myself. So thank you.
Thank you so much. You guys do such a lovely job. I've had the pleasure of working with you both in various capacities in the past. And as always, such a wonderful presentation. So thank you both for being here and creating space for caregivers. I think that a lot of us on this call, I recognize a lot of names of the folks who are joining us here today, but I also want to call out that I do see a lot of new names here today. And I think that that is a lot of caregivers who are joining us today and maybe don't attend some of the other Thrive Series sessions that are geared towards our patients and survivors. So I just want to call that out and say thank you so much to both of you, Allison and Pam, for making space for that today. We are going to take some questions now, but before we move on to that, I just want to take care of some housekeeping. So in the meantime, feel free to start adding those questions into the chat box, and we'll get to them in just a quick second. But before we move on, I wanted to send a reminder to everyone, especially those of us here tonight who may not have participated in the Thrive Series previously, that we will be sending out an email survey later tonight. And we'd love to hear your feedback so that we can continue to offer really engaging content and content that you're looking for as a survivor or caregiver or both. So please do take a minute to complete that survey. You are entered for a chance to win a swag bag full of Masonic Cancer Center goodies. So definitely be sure to do that. And then I am going to take a look here in our chat. We've seen a lot of really lovely comments from our attendees, just thanking you both for sharing your stories and your resources. Let's see, I'm just taking a look here to see if there's any specific questions. If anybody wants to add that question, or you should have the capability to unmute yourself and you can verbalize a question if you'd prefer to do it that way. So we'll give folks just a minute there. I know that you both did touch on a little bit of this idea of self-care and caring for yourself amidst, caring for someone else. Would both of you care to share just, maybe another anecdote or tidbit about ways that you do care for yourself, or ways that you lead on your community to help create space for yourself?
Sure, absolutely. One thing I like to say is that delegation is actually a form of self-care. So I think a lot of caregivers are afraid to ask for help. But what I have found is that often people are wanting to help when they know that something's going on and they're not sure how. And so I think that a way that I care for myself is by asking others to step up and to do some of those things. And so even today, as an example, like someone said, or I think I mentioned earlier that someone had come and raked our leaves, but then they left all the leaves in the bags. And I live in St. Paul, and St. Paul does not do anything with those leaf bags. And so I had put out an ask to my community and just said, is there anybody who might help me by hauling these away? And technically I could have, and there's always that voice in the back of my head that says, Allison, just put them in the car, take them to the spot. But I thought, no, I would be better served, right? It's a form of self-care for me to ask if someone else, and a friend said, I would be happy to. Came over, put him in his car, took him to his house in Minneapolis where they do pick up leaves, and off they went. And it just, so it's little things like that. So, I mean, I certainly do a lot of things, like I try to do meditation and I try to go to bed early and all of those kind of things. But I think sometimes it's just taking the things off my plate and realizing that I don't have to do everything. And so I like to say, like I said, the delegation itself is a form of self-care.
Thanks so much for sharing that, Allison. Pam, did you want to share anything? I don't want to cut you off, but I do have another question too.
I second what Allison said. I find myself when I'm able to do that it just helps tremendously. We have so much on our plate. So again, just having that one less thing to do can be so very helpful. I've also learned to not be afraid to ask for help, that it's okay, and that people do want to help.
Absolutely. Yeah, I think we, in this day and age, I feel like we see a lot of that good out of community groups. I know I'm a part of like my neighborhood community group online, and you really do see all the good there. So that's great advice. I did have a direct question come in here regarding younger family members and getting them involved in caregiving or being a part of the experience. If you two wouldn't mind addressing that.
Yeah, sure, absolutely. So like I sort of mentioned, my daughter, this has been her whole lifespan, right? And so what we've kind of done with her is like when he first was diagnosed, she was 4. And we have, at that point, it was when he needed his bone marrow transplant. And we sort of just described it in 4-year-old terms and said, Dad's blood is sick. He's going to get Uncle Adam's blood and it's going to make his blood better, right? Whereas now she's 17 and, we can tell her all the things. But we also don't want to assume that she wants to know all things. So even last night we were about to sit down for family dinner and the surgeon called with the pathology results. So this conversation could have gone either way. And so when we finished the conversation, I said to her, we just heard from the surgeon, like what level, the news was good. What kind of level of information do you want? She's like, that's it. He's good. No radiation. Great. So I think it's sort of feeling them out and letting them know, giving them the age appropriate help. But then letting them know that they can know as little or as much as they want. And then also the same thing as far as involving them, right? Like I said, we've found ways over the years to involve her with things, but also to find that line of she doesn't have to do those things. It's so that she doesn't feel like she's a caregiver, but that she can be involved so that she's not sort of like blocked off from this big part of our lives. And I think same thing even for like visiting the hospital, right? She has the option if she wants to do that, but it's not like you have to go visit Dad in the hospital. Like she gets to have autonomy in that.
Mm-hmm.
Mm-hmm. What I'll say is, while I'm a caregiver, I'm not a caregiver to someone who has cancer. I'm a caregiver to my son who was hit on his bicycle by a hit and run driver, and it left him blind, nonverbal, and quadriplegic. And he has an older brother who's 16 months older than him. So my older son, Ryan, is 22, and my son, Austin, who was in the accident, is now 21. And what I would say, well, first of all, caregiving is universal, as I said earlier, but it's different. It's completely different if you are caring for someone with cancer versus someone who has Alzheimer's, stroke, or someone who is nonverbal. The challenges are different, right? And we all know family dynamics make things different, right? There's so many variables when you think about caregiving. So what I'll say is, Allison had kind of mentioned it too. To me, with my older son, it was almost trying to find that balance of what he wanted me to share versus not share, because I found myself sometimes maybe saying too much. And it just upset him. I think even when I think Austin has a good day, like, he swallowed, 3 times. And even though that's a small but very mighty blessing, sometimes I think when I am trying to be positive in terms of bright things that we are seeing with Austin, sometimes I think that just further sets in the reality of how he's lost his brother in terms of what his brother used to be able to do and be like. So I do think it's a balance, and I think it just is just having open conversations with your children, perhaps at, depending on their age, but maybe, what are they comfortable with hearing and seeing and doing and wanting? So, yeah.
Thank you both. I think that that's so true. I like what you said about, everything kind of being its own unique experience. And as we've learned from you both today, not only is the patient, the survivor experience unique, but as is each individual caregiver's experience. So I really appreciate that. I did see one question come in the chat here, just kind of flashing back to our previous topic regarding asking for help. So if someone doesn't respond, what's a good next step? So if you offer to help someone and they don't respond, what do you do at that point?
Yeah, so I think this is because I think Anne mentioned that she's an oncology nurse. And so I'll answer both from sort of the medical perspective, but also from the sort of community friend perspective. Because I think that if you're an oncology nurse and you're coming into the patient appointment and in front of the patient are saying, Allison, how are you doing? And would you like to receive any of our services? In front of my loved one, I might say, I'm fine. It's not about me, it's about him, right? And so I think in that medical setting, it might be about pulling the caregiver aside, and finding time, which I know is hard to do, but to find time to say, how are you doing? Did you know that right here in the clinic, we have a social worker available, we have all of these things, right? And to offer it in that other space, right? So it's not, doesn't feel like it's right in front of the person, the patient. If you're asking for more of a friend perspective, I think I would start, again, being really specific. I'd like to bring dinner. Do you want it on Tuesday or Thursday? I would love to help. Do you want me to rake your leaves or walk your dog? And I think that, I would ask, a couple times, or things that feel to the caregiver like it's not a huge burden on you. So I've had people say, hey, I'm headed to Target. Is there anything you need? Hey, I'm headed to the hardware store. Is there anything you need? And then that feels like it's not too much of an ask, right? The other thing we've had some people do that I think that I appreciate, and I've heard other people do as well, is just there's some things that everybody needs, right? We've had people who have sent things like paper towels and toilet paper and, like peanut butter, like stuff that you don't have to say, like, give me your grocery list. They just have sent stuff. Like I have a friend who sometimes just sends random groceries that she just thinks that we might like. And they're just generic things like milk and bread and eggs. And so I think that especially if you know the person well enough, or if you just know that like everybody's going to need toilet paper at some point, and it's just going to be really nice to have extra, and to take that off your list, that you can just say, hey, I just put some things on your front steps. No, and a huge one that I love to say is this phrase, no need to respond, right? So if you text and say, I'm thinking of you today, or I'm going to drop this off, or whatever, to end with no need to respond. Because if you don't, and you just text them or leave a message, that's again adding something to their list because they think they need to respond. But if you put no need to respond, it's just like a pure gift that you're giving them and you're not expecting anything back.
That's an amazing tip. I love that.
Mm-hmm.
No need to respond. Wonderful. Well, I want to thank you guys. We are running out of time here. So just thank you both again so much for all of the time that you've spent with us today and all the time that you spend every day helping caregivers to live their best lives and do their best caregiving. So thank you so much. As a quick reminder, we did record this session, so that will be available on our website by the end of the week. You'll receive that email tonight with the quick survey, so do please submit that survey, and you'll be entered to win a swag bag of all sorts of fun stuff from the Cancer Center. And then I did just want to highlight, while this is our last Thrive series of the season, we will be coming back to you for our annual Spring Cancer Survivorship Conference. We are planning to have a caregiver specific session, so we hope that you'll join us for that. Please save the date for Saturday, April 12th, 2024, and that will be offered as a hybrid event as well, so you can choose to attend in person on the University of Minnesota campus in Minneapolis, or you can attend online just like you did tonight. So stay tuned for more information. Thank you guys again so much for being here tonight, and everyone have a great evening.
Thank you. Bye.
Thank you.